an exemption for medical or religious reasons. I received my flu shot on Wednesday. It was simple, it was painless, and now I'm better protected against COVID than I was before I got it. Our next flu shot clinic is October 20th at Thompson Bowling Arena. So you can find more information on how to register by going to campus calendar at calendarutk.edu. Let's all do our part to protect our healthcare system, ourselves, and one another. So we also had our first home football game over last weekend. And I want to thank everyone who cheered on the Vols responsibly, whether it was at home, at a socially distanced gathering, or at Neyland Stadium. I'm really proud of our student athletes for their hard work on and off the field. And it was a great victory and a great celebration. And I'm looking forward to one tomorrow as well. So let's get to today's update. I have with me again, Dr. Spencer Gregg. Dr. Spencer Gregg. I don't dread you, Spencer. I'm really glad you're here. And Provost John Zomchik. So first, we're going to take a look, like we always do, at today's case count. So let's take a look at the data. So again, you see that sharp peak we had, and then a sharp decline, and now our numbers down there are kind of flat. As of today, we have 61 active COVID-19 cases. 59 of those are students and 2 are employees. Today's total includes 14 new recoveries since yesterday. There were also 9 new active cases reported yesterday. So we just keep looking at the overall direction of those numbers each day. And we now have 268 people in quarantine or self-isolation. Of those, 239 are students. And remember, quarantine is for students who are close contacts, who have to quarantine for 14 days. Isolation are students who have tested positive, and they are isolating themselves from other people for at least 10 days. Okay, so Dr. Gregg, I've got some questions for you. Like we always do, I can make my interpretations, but I think it's much more valid to hear it from you. What do you see in these numbers today?
Good morning, Chancellor. It's a pleasure to be with you on this big orange Friday morning. It's great to see that our overall campus case numbers appear to be leveling off, especially into these lower ranges, and that we've not seen another significant increase in our active cases. We're hoping that this trend's going to continue through the remainder of the semester. But as more campus-wide testing's performed, I think we could anticipate our case counts to go up somewhat. Fortunately, we've, obviously, as a result of fewer active cases, we're also seeing a decline in those that are needing to self-isolate because they've tested positive or been identified as a close contact. Fortunately, we've had very few faculty, staff, or student hospitalizations reported to us, and we've not had any reported deaths due to COVID, but that's not true for our greater Knoxville community. There, we're seeing an uptick in both hospitalizations and deaths, especially in those older than the typical college-age population. With these trends, it just indicates that although on our campus, our numbers appear to be looking a lot better, it's still imperative that we all remain diligent in following health and safety guidance that's intended to protect not only ourselves, but also others, and especially the people that are more vulnerable in our community.
Okay, so let me ask you another question, kind of 2 parts. So what trends are you seeing in the Student Health Center? Because that's where people come to get tested. And also, what are your contact tracers telling you? What are they seeing?
Well, at the Student Health Center, we're seeing a steady need for testing of both those with symptoms that possibly could reflect COVID infection, and with those who've tested in a positive saliva pool in one of our residential facilities where the pooled saliva testing is occurring. Of these students, fewer are testing positive now than over the past several weeks, and that's certainly a good sign. Our contact tracers are still noting that many who are testing positive, especially those that have gone off campus to be tested, are still not submitting their self-isolation forms in a timely manner, and that could be placing others at risk of exposure. But fortunately, we've not identified any recent recurrence of clusters on campus. Our contact tracers have also noted the that the greatest percentage of those self-isolating are those who've been identified as close contacts, not those who have tested positive. And that makes sense, and that's the way it normally should play out. Typically, those the close contact is still the result of either sharing living spaces, especially in our off-campus apartments, or in small social group gatherings where social distancing has not occurred. And that speaks to the importance of adhering to health and safety guidance, even when we feel like it might not be necessary.
Okay, so let's talk a little bit about testing. I want to share an update on what we've been doing, and then again ask Dr. Greg some more questions. So we're now several weeks into our comprehensive testing strategy. We have a testing strategy. We are implementing it. Last week, we conducted pooled saliva testing of residents in Dogwood and Magnolia Halls. On Monday, we tested residents in North Carrick, and on Tuesday, we tested in South Carrick. Yesterday, collection took place at Fraternity Park, and this morning, we had a sample collection for anyone who missed their testing window. I want to ask Dr. Greg about those test results in just a moment. But first, I want to thank you, all of the students who participated so far. This is so important for our overall plan for keeping our campus safe. As a reminder, if you live in a residence hall, fraternity, or sorority house, you signed a contract. And part of that contract was agreeing to testing protocols. It is required. It is required. If your hall was tested and you have not participated, please pay attention to the makeup dates. Failure to participate in saliva testing or any necessary follow-up testing will generally result in disciplinary action for the student code of conduct. Above all, these testing protocols are in place to keep you, your fellow residents, and others across campus healthy and safe. It is important to do your part. Please do your part. When the time for your testing comes around, do your part. Students in residential facilities will get an email notice before their test date. Students who miss their date will get an email about a makeup time. We are also listing the test days on the events calendar. So, Dr. Greg, what have we seen in all these testing results over the last 2 weeks, these different dorms and houses where we've been?
So over the past 2 weeks, we've tested 5 residential sites, including Dogwood Hall, which had a participation rate of 76%, and 6 individuals in positive pools who were referred to the Student Health Center. Of those, 1 tested positive for COVID. Magnolia Hall, which only had a 51% participation rate, didn't have any positive pools, so no one from there had to come to the Student Health Center for testing. North Carrick had 12 individuals that were referred to the Student Health Center, but they only had a participation rate of 41%. Then South Carrick had a participation rate of 63%, and 19 were referred to the Student Health Center for further testing. The cumulative data on the total number of true positives from the North and South Carrick are still pending, so we don't have all the results back on the ones that had to do follow-up PCR testing here at the Student Health Center for those. And then the samples from the Fraternity Park yesterday haven't been fully processed yet, and there was a participation rate of 59% there.
Okay, so let's go back to that just a minute and walk me through it. So you said Dogwood had 6 individuals that were referred to the Student Health Center. I assume that's because the pooled saliva showed signs of the virus. So how is it then that only 1 person ended up being positive? Can you explain that?
Yeah, it has to do with how we set, different labs can set their bottom line or their threshold for what is deemed a positive or a negative. And it really depends on the type of testing system you're using, the labs that you're using. So it's not necessarily consistent across the board. It's kind of like you could get a potassium level done at one hospital and it could be one number and that's considered normal, but at a different hospital, you may have a different potassium level number and that still could be considered normal by their reference ranges. So each lab is not consistent. Our saliva lab has based their threshold based upon the information that they have for the type of test that they're performing. And so because someone has met that threshold for what would be a likely positive, then they get referred over. But according to our standard, the reference lab that we're using, it does not meet their standard. The idea here is that when we're doing a test for the virus, we're testing for components of the virus. And simply because components of the virus may be present doesn't necessarily reflect a true infection with the virus. Someone potentially could have been exposed months ago and had an infection, been totally asymptomatic, be over it now, but still have remnants of that virus in their respiratory tract that's showing up. So that threshold has to be set where you're not capturing everybody in that regard, but capturing those who are most likely to be infectious and able to spread an infection. And so obviously, the higher your RNA components from the virus are, the more likely that that is to be the case for you. So that's why we were able to have essentially, it looks like one pool from Dogwood that came out negative on our PCR testing, but was a positive pool from Dogwood. Another potential reason is that there is a delay. Students are tested with the saliva one day, and the next day is when they get their PCR testing. It's very possible for someone to potentially test negative on one day, positive on the next, or vice versa, depending upon what their viral loads are. So that could be the reason for the discrepancy.
Okay, so the bottom line is we're continuing to move throughout the campus. The infection rate, positivity rate is much lower than it was initially, like for Massey. From last week, North Carrick, South Carrick, we want more people participating and participated so far. And again, it's not optional. So we look forward to all those students who didn't make it the first day to make sure they're there the next day. And I guess one other thing I would ask Dr. Gregg is, isn't this testing, we're going to be doing this all throughout next semester. Am I right?
That's correct. We'll be continuing it into the spring semester.
Okay, so standing back from where you are, what conclusions are you drawing right now with all the pooled saliva testing we've done so far, followed up by the PCR testing? Where are we with this?
Well, I can tell you that my first conclusion is that there's a lot of students that are wanting to participate. And I really appreciate that. And I commend the students who participated in our testing over the past 2 weeks. We understand that some students were unable to participate due to other circumstances. Because so many students have actually contacted us about being unable to participate on the particular day that their hall was tested, we're making weekly makeup events available, and I'm sure that'll help with our participation rates. I'm impressed that so many students want to make sure that they're involved, and we really appreciate their desire to help others.
And just one last thing, why is it important that everybody in the residence hall submit a sample?
Well, we're not going to have sufficient data until we have better participation. And it makes it hard to come up with any real conclusions when the data is suspect. So having sufficient data by greater participation helps us to identify trends that then help us to more clearly identify what mitigation efforts need to be taken on campus.
Okay. Thank you so much. So let's switch from data, the positivity rate, testing to academics. We're now about halfway through the semester. I'm so proud of everyone, the way everyone's adapted, students, faculty, staff, and I know it hasn't been easy. I want to ask Provost Zomchik, what can you share? You're in charge of all the academic activity on campus. What can you share about how the semester's going? What's working well? What adjustments have we had to make along the way?
Thank you, Chancellor. I'll be happy to share some information, some of which I've gathered firsthand from our students that I've had the good fortune to talk to. I love to talk to our students. As you said, we're about right at midterm. And so I think our faculty and our students have really settled into this very unusual semester. What I've been really impressed with is that both groups, faculty and students, are making adjustments as we go. And, you know, there's so much evidence of resilience and flexibility on the part of our students, on the part of our faculty. And just to give you an example, I was talking to a group of students who were having lunch under one of the tents that we have on campus. These were students who were majoring in theater. And if you think of a kind of discipline, a subject where you really need to be present, it would seem that theater would be one of those, but they've adapted. They are having acting classes online. And like so many of their students, and all of us really, we really want to get back to normal, but they say it's working and that they're learning a lot. And their faculty are especially inventive when it comes to the kinds of exercises that are going to help them develop their acting skills. You know, we've also heard that one of the biggest challenges has been for our faculty to manage a population that's present there in front of them in the classroom, and one that is also distant. They're zooming in remotely from their residences. I think we all know how hard it is to split our focus. That's why, for example, they tell us not to operate heavy machinery, any machinery and text at the same time, because it's difficult to manage both of those tasks well. And so we've become more and more aware of the challenge of having to address an in-class audience and a remote audience. And we're working, especially with our faculty in our Haslam College of Business, about ideas to sort of eliminate that split in the focus and make it easier for both the remote audience and the in-class audience to have the attention. We're going to be talking with faculty. We're going to be offering information to faculty to help them manage these particular challenges. But, you know, all in all, I'd say that things are going really well. Our students are sort of bearing down, taking their midterms, and our faculty are delivering the excellent instruction that we know that they've always delivered.
Thank you, John. I know that both Provost Zomchik and myself and several other administrators, we're all teaching each of us are teaching a class this fall, a first year studies class, and it's been great for us to be in there with freshmen every week. And I know I feel like I have a much better feel for where many of them are at, and a better feel for what the faculty are experiencing. Just what you talked about is there was a couple of weeks when half my class was in quarantine, and it was awkward trying to make sure everybody that's on Zoom is involved and can hear the class. But at the same time, we're now all back together again because everybody's well, and it's been really great. And learning about their experiences has been valuable. So I just want to thank everyone for joining us today. You know, I want to say something about the return of athletics and football. I know that most of us last week felt like just a little bit of normalcy was coming back with having a football game on campus. And I think it's lifted all of our spirits. And in that vein, today, we're having a special lunch tailgate menu over at Presidential Court. I'm headed there myself. And just to give you a few updates, there will be, the part that looks really good to me is the popcorn shrimp, taco meat, nachos, hamburgers, hot dogs. I'll be over there with students celebrating the fact that we're getting to do a lot of things that we want to do in spite of COVID. And it's just a great time to be involved, even though it's a crazy time to be involved. We're going to be cheering on our football team as we take on Georgia tomorrow away. So I know everybody will be glued to their TV and cheering for our team and our coaches. Also, next week, Monday, kicks off Spirit Week. This may be a year unlike any other in a lot of ways, but we want to remind students that this is a university unlike any other. This is Rocky Top. All week, we will hold more than 45 events, either socially distanced in-person events or virtual events to celebrate the volunteer spirit. It will kick off with a big orange pumpkin patch and International Festival on Monday. So please visit the campus calendar to find out all the events. Lots happening. To everyone who's on this call and everyone who's going to listen later, thank you so much for continuing to do your part to keep this virus from spreading. Be safe this weekend. Enjoy the game tomorrow safely, and go Vols.